Hi, Connie. Thank you so much for joining us today. We understand that you had contracted COVID but are now recovered. Could you tell me a little bit more about that process?
Yeah, I'm doing great, just so that everybody knows. It wasn't near as bad as what kind of was out there and what I was afraid of and what all my friends and family were afraid of. It just started out, I had some allergy symptoms, which was odd because it was still kind of wintry up here on my little mountain. And then I got a very bad headache. I started to have a little tightness in my chest. And then I started to feel sweaty, those kind of things going on. And when I talked to my daughter about what I was feeling, I also lost my sense of taste and smell.
Interesting.
She wanted me to go ahead and call the hotline, so I did. I called the hotline, Star Valley Health, and they were awesome and encouraged me to come on down and to have a test. I had pneumonia about 5 years ago, so they're a little concerned about my lungs being compromised. So I went down and had the test on a Friday afternoon, and that Sunday I got the results back that the test was positive. In that couple of days, those couple of days were probably some of my worst. I think all of the symptoms lasted almost 2 weeks, but I only had probably 3 to 4 days where I could say that I was sick and I needed to stay home, but I never was so sick I needed to be hospitalized.
Oh, fantastic. And do you know where you contracted COVID?
I don't know for sure. I do work in Jackson, but I live in Star Valley. I frequent lots of stores between here and there, so it's pretty hard to say. I do have a public relations job, so and I meet and talk to a lot of people. We were very good about wearing masks and gloves and doing all the things that we'd been told to do. So I think I was protected as well as I could be.
Yes.
But at some point I picked it up.
It's just one of those that
Yeah.
you catch. And so tell me what recovery was like. What did it take to heal? What were some of the medications that worked well for you?
Yeah, basically a lot of rest. I was
Okay.
very, very tired. If I would suggest anybody who gets it, don't be afraid of those 3 or 4 naps a day. You need them. Lots of rest. Tylenol was great for my fever. I took Aleve for my body aches, and I alternated them back and forth. And between the two, and resting a lot, lots of fluids. Occasionally I had to take a cool shower, to feel a little better and a little more comfortable, but mostly just rest.
And so it felt like the flu, maybe a little bit worse.
You know what? I've had the regular flu about 7-8 years ago. That was worse. That was worse than this was.
Okay.
There were a few days where tightness in my chest, a little short of breath, but not anything I felt like I needed to go to the hospital for. But it was uncomfortable. The body aches and the tiredness. I don't think I've ever remember being that tired for that long of a period of time.
Okay.
But again, not anything I felt like I needed to go to the hospital for.
And when did the hospital tell you were recovered? Did you go back in and take another test?
No,
or-
they actually, when I had to go 3 days and be totally symptom free.
I see.
That no headaches, no fever, no body aches, no coughing, nothing like that. After 3 days of being free of all symptoms, then they consider you clear. They still recommend that you take precautions, and I did. I was already working from home, so it was easy for me to stay in, and I did. I didn't leave the house. I was only sick, like I said, 14 to 16 days, but I stayed in the house for a solid 21 days.
Just to be safe. And
Just
make
to be
sure
safe.
That, you're
Yeah.
not getting anything else or passing
Absolutely.
anything on. Wonderful.
Yeah.
And it sounds like you've had a really good support network, that people have been really kind and
They have.
helpful and picked up what you've needed.
They have. Everybody was great. Like I said, from you folks all the way to my work and family, friends. There's always drop-off service if you need it, but I was very fortunate. I had friends who convinced me to have enough, to take care of myself, and I didn't need a thing.
Oh,
Like I
that's
said,
great.
other than rest.
And any other advice for anyone that might contract the virus, or anything they should do?
I would say, like I said, just watch your symptoms. Don't, I thought it was just allergies. I started taking allergy medicine, but those are some early signs of the virus. Make sure you're staying home when you feel like that. I was very fortunate. We had actually had someone in our area that had contracted it, so I had already been home for 3 days on a precautionary precautionary measure, and so I'd already not been around anybody for the 72 hours that they worry about that you're going to, give it to someone else. So I would say if you feel any symptoms whatsoever at all, stay home, monitor those symptoms, call the hotline. All the folks on the other end of that, are great about talking to you and talking you through it. And, protect yourself and protect other people if you're not feeling well. Stay home.